Arizona Senator John McCain has been diagnosed with brain cancer. The disease was discovered following a procedure to remove a blood clot from his eye late last week. The news sending shockwaves throughout the political world, with his Senate colleagues rallying around him.
He is somebody of incredible credibility, as well as great courage and great character, and if anybody can beat this, John McCain's the man.
I don't know, God knows how this ends, not me, but I do know this. This disease has never had a more worthy opponent.
He wants to get back, always thinking about the Senate and working and getting things done. That's just the way he is. He's a real warrior, and he's a national hero.
Yes, he is. President Trump issued this statement following the news, saying, Senator John McCain has always been a fighter. Melania and I send our thoughts and prayers to Senator McCain, Cindy, and the entire family. Get well soon, John. Joining us now is family and emergency medicine doctor Janette Nesheiwat. Good to see you, Dr. Nesheiwat. Thanks very much for joining us. Tell us the severity of this. Can he survive this?
This is very serious, unfortunately. The statistics show that once you're diagnosed with this sort of a brain tumor, it's called glioblastoma, and in Senator McCain, it was found to be a primary glioblastoma, which means it originated in the brain. About 30% of people can live up to 2 years on average. Up to 10% of people can live up to 5 years. But, he underwent surgery on Friday. He underwent what's called a craniotomy, which means they made an incision behind the eyebrow. They opened up the bone, the skull of the brain. They went in to remove that tissue, to remove the blood clot, which was found to be associated with the brain tumor, glioblastoma, which is considered a malignant, cancerous type of tumor. He had the surgery. He's going to now discuss options, most likely with his doctors, to see if he wants to move forward with chemotherapy, with radiation. But from what I understand, after his surgery, he's doing well right now, recovering well and in good spirits. And as we all know, he's a hero, he's a fighter, he's a true inspiration, he's a leader, and it takes a lot of courage, and which he has to get through this.
Yeah. Doctor, the standard of care, which you mentioned, is tumor removal, then a combination of radiation and chemotherapy. But there are a lot of newer treatments. There's been a great deal of focus in the medical community because this type of cancer, although somewhat rare, about 2% of all cancers are glioblastoma, but it is because it's so aggressive. But you have work with immunotherapy, for example, even viral therapies where you have genetically modified viruses like the polio virus,
that's right,
which the Duke University Brain Center has been working on, and then also even like electrode caps that the glioblastoma patients wear to keep the cancer from growing.
Sure.
So there's a lot beyond just the standard of care,
that
right?
certainly does give us some rays of hope. Some of those trials, some of the trials that are going on right now, and some of the treatments that you mentioned have shown some promise in some patients, but it hasn't shown long-term, long-lasting effects. But at this point, if there's something out there it's worth giving it a try, absolutely. These are the same, unfortunately, the same brain cancer that Senator Ted Kennedy died from, and then last year, most recently, Beau Biden also passed away from. So
would you expect now treatment? He's not coming back for a little while. We know that.
Right now, his doctors want him to recover, take a week or two at least off from the surgery that he just had last week.
Right,
but
you can't. I think you have to
wait a certain amount of time,
right, until you start brain radiation.
You start further treatment.
There was some speculation that his being confused in one of the hearings was now maybe explained by this. Is that a symptom of having such a tumor?
It's very possible. Headaches, dizziness, confusion, slurred speech, blurry vision, which is what he initially complained about to his doctor, which prompted his doctor to order that CAT scan, which I commend his doctor for doing that. So it very well could have been related and could have been from, some early symptoms, signs and symptoms of what was going on, especially with communication and language in the frontal lobe of the brain is responsible for that.
So there's no aggressive treatment out there that specifically, I've read about specifically treating your body type or like a medicine that's actually made for specific people and their genetic makeup?
Sure. Right now, there's no cure for this type of cancer. It's a very aggressive, debilitating cancer, but it's treatable. And the standard of care is usually surgery, chemotherapy, and radiation. But for those who are over age 70, you know, it can be a little hard. It can be harder to deal with all of that therapy. So that's why Senator McCain will discuss with his family, with his doctors, to decide what's his path, what's his direction, what he'll want to proceed with.
Just on a personal note, to commend the McCain family and the senator for being so forthcoming about the exact cancer that he has and the treatment that they are weighing at this time, because it really does mean a lot to anybody out there. Anyone who's fighting cancer, anybody who is dealing with this specific disease, because a lot of people are not so forthcoming, and I think that it's an incredible support system when somebody can speak out like that.
Takes a lot of courage.
Absolutely.
Dr. Nesheiwat, good to see you.
Thanks
very much for weighing in here on this terrible
Our
story.
thoughts and prayers with Senator McCain and his family.
Absolutely. Thank you.